I'm Dr. Kelsie Raspin and I'm a postdoctoral research fellow at the Menzies Institute for Medical Research at the University of Tasmania. I really enjoyed studying science at college, so I decided to go and do a Bachelor of Biomedical Science degree at uni. I then undertook honours at the Menzies Institute with Professor Joe Dickinson studying blood cancers. In 2016 I then started my PhD studying prostate cancer, and then in 2020 I graduated from my PhD. Since then I've been a postdoctoral research fellow at the Menzies Institute, and I mainly focus on prostate cancer development and its progression to metastatic disease. I work on many different projects at Menzies, but they all focus on understanding why prostate cancer occurs and its progression to metastatic disease. So I'll talk about 3 projects. So the first one aims to identify genes involved in prostate cancer progression to distal sites such as the bone. So using patient matched samples, we aim to perform genetic analysis to identify genes that cause the prostate cancer to become metastatic. And in this case, we can target these particular genes using targeted therapies. We are currently in the process of establishing a zebrafish model to assess our genes of interest in a cancer model of metastasis, and we can then test therapies in this model as well. The second project that I work on is a familial project. So we have 70 Tasmanian families that we have DNA from their relatives as well as prostate cancer cases. And we use these families to identify genetic changes that increase risk in these prostate cancer families. Following functional characterisation of these particular mutations, we can then feed this back to the community, where men with a family history can then go and be screened for these particular mutations to identify their lifetime risk of prostate cancer development. The third is my new project called Precision Care for Men with Prostate Cancer in Tasmania, or PC for PC-TAS, which has been funded for 3 years by the Royal Herbert Hospital Research Foundation. Here we will return clinically actionable genetic results to these men. This genetic information may inform treatment, so they can be treated with newer, more targeted therapies. And our study will also test the potential and feasibility of genetic testing here in the Tasmanian healthcare system. The project will run in parallel with a consumer engagement arm, where we'll talk to men who have been diagnosed with prostate cancer about their opinions, expectations and perceptions of the use of genetic testing in the clinical management of prostate cancer, which will ensure that our research is patient-centred. I think for any researcher in my field of work, their successes really drive their motivation, so recognition at a national and international level is really the epitome that we all strive for. However, I've been really fortunate enough in the last couple of years to work more closely with the Tasmanian community and to see firsthand how impactful my research is and how in awe people are of my research. So it really shows that what I'm doing is of value to everyone around. Outside of work, I help run a local netball club. I'm also a player, coach and umpire of netball. I really enjoy travelling with my family, and I was born and raised on the east coast of Tasmania, so I really enjoy getting up there on a sunny summer's day to enjoy the water and the weather.